Assalamu alaikum everyone. I hope all students are okay and must be working hard. That's pretty good. Well, before I start about today's topic or topics, um, I want you to recall session number 13 because it's very important to recall session number 13 because that is very much connected with this session. I hope that before you start thinking about listening to me, so far as this session is concerned, I want you to recall what we've done in session number 13 because both these sessions are interconnected, right? Well, dear students, welcome to session number 14, and that is the second session of week 7. Well, I talked about that you have to connect session number 13 with this one because this is very important. Both are connected sessions in the sense that in the previous session we tried to describe the consonant sounds of English, but this time we are going to describe, but the more emphasis will be on the elaboration of speech sounds so that the consonants are concerned. So today's topic is not only the description but the elaboration of speech sounds, and definitely our focus shall be on the consonant sounds of English. Okay? Before we talk anything else, I hope you remember the 5 kinds of information. This is what I have been talking to you during last 2 or 3 sessions. Do you remember? The nature of the airstream mechanism, the state of the glottis, the position of soft palate, the articulators involved, and of course the nature of the stricture. Most important, exactly. I'm not saying the others are not, but this is very important. So please, whenever you are going to describe consonants, never ever forget this or these. Number 1, the nature of the airstream mechanism, the state of the glottis, the position of soft palate, the articulators involved, and most significantly, the nature of the stricture. All right? During this session, my dear ones, remember we are going to talk about the fricatives and the other ones. But first of all, I am going to pick up fricative sounds for you people. In the stop t, the tongue tip touches the alveolar ridge and cuts off the airflow. I hope you remember this is what I told you during the last session. Do you remember? When I talked about t and d, and at the same time I also talked about n. Yes, exactly. We were talking about 2 stops. So in the case of t stop, it is t, which is stop. The tongue tip touches the alveolar ridge and cuts off the airflow. Now in s, the tongue tip approaches the alveolar ridge, but it does not quite touch it. So far as t is concerned, I told you and I'm telling you the tongue tip touches the alveolar ridge and cuts off the airflow. But when we talk about s sound, the tongue tip approaches the alveolar ridge. It approaches the alveolar ridge but doesn't quite touch it. S. Now there is still enough for an opening for airflow to continue, but the opening is narrow enough that it causes the escaping air to become turbulent, hence the hissing sound of the s. Now what happens? Our tongue is primarily, tip of the tongue is approaching the alveolar ridge. But do you think that it is touching? No, absolutely it's not touching. I want you to produce this sound so that you can feel it. Say after me. S. You can have the hissing sound of s, but remember there is still opening. It is narrow enough, and that causes the escaping air to become turbulent. S. The tip of the tongue approaches the alveolary. It is approaching, but it's not touching it, isn't it? Okay? But in the case of ter, what happens? That the tip of the tongue is touching the alveolar ridge, ter, and it cuts off the airflow. For the duration, whatever the duration, it remains there. But so far as sir is concerned, yes, the outcome is the turbulent air, of course, producing the hissing sound. Yes, there is hissing sound. Okay? Remember, in a fricative consonant, the articulators involved in the constriction approach get close enough to each other to create a turbulent air stream. It's very important to us understand what I'm saying. I am saying that in fricative consonant, the articulators which are involved in the production of all these fricatives, so in the constriction approach, get close enough to each other. The articulators try to approach each other, and there is closeness among them, because it is because of their closeness that we can have a turbulent air stream. For example, I am presenting before you these sounds, and you can understand what I am saying, which is written over here. F. Do you feel some sort of turbulent air stream? F. I'm deliberately getting close to my computer so that you may understand the turbulent air stream. F. V. Th. The. S. Z. Sh. And j. So you can feel now the turbulent air stream. Why? Because definite the articulators, whichever the articulators are which are involved, and you know them now, they get close to each other to create what? A turbulent air stream. And the English consonants, those which are fricatives, are under this category: f, v, th, the, s, z, sh, and j. Now let's talk about approximants. Remember, in an approximant, the articulators involved in the constriction are further apart, still than they are for a fricative. The articulators are still closer to each other than when the vocal tract is in its neutral position, but they are not even close enough to cause the air passing between them to become turbulent. Now, in fact, unless until I have just read them, I mean these two statements, because I want to approach the third statement, because herein we have got these sounds. When you produce these sounds, you can understand what I am saying. The English approximants are w, y, r, and l. W, y, r, and l. And what I am saying, the articulators are still closer to each other than when the vocal tract is in its neutral position, but they are not even close enough to cause the air passing between them to become turbulent. So there is no turbulent air stream when we produce w, y, r, and l. Right? This is what I talked, of course, in the previous sessions, and I hope you can recall. Now let's give some time to affricates. An affricate is a single sound composed of a stop portion and a fricative portion. What I am saying? An affricate is a single sound composed of a stop portion and a fricative portion. That means this sound has got two portions. One is the stop portion and the other one is the fricative portion. For example, ch. When you produce this sound ch, the airflow is first interrupted by a stop, which is very similar to t, though made a bit further back. Ch. Two portions are there. One is the stop portion, where there is a complete closure. Yes, exactly. And then there is a release. And then fricative portion. Okay? But instead of finishing the articulation quickly and moving directly into the next sound, the tongue pulls away from the stop slowly, so that there is a period of time immediately after the stop where the constriction is narrow enough to cause a turbulent airstream. Now say again ch, and whatever you have heard in this statement, that is applied here. Ch. In ch, the period of turbulent airstream following the stop portion is the same as the fricative sh. Okay? English j is an affricate like ch, but voiced. Ch is voiced or voiceless? Yes, exactly, that is voiceless. But so far as j is concerned, that is voiced. Alright? So you must understand affricates. What? Having two portions. The first portion is just like the stop, and the next one is the fricative. Okay? Let's have some sort of concentration on laterals. I want you to pay attention to what you're doing with your tongue when you say the first consonant of leaf. In leaf, what is the first consonant? L. Your tongue tip is touching your alveolar ridge, and perhaps sometimes you can feel that your upper teeth. But this does not make L a stop. When we produce the sound L, remember we are talking about laterals, and there is sound L. What happens? Air is still flowing during an L or L because the sound of your tongue has dropped down and left an opening. Some people drop down the right side of their tongue during an L, L. Others drop down the left. A few drop down both sides. Now what is your category? Do you drop right side or the left side? Or both sides? For example, I use the both sides. I say L, L. So both sides of my tongue, they are allowing the air. So they are not stopping the air, they are letting the air. Both sides are letting the air to go outside through my lips. Okay? So sounds which involve airflow around the side of the tongue are called laterals, always remember. Sounds which are not lateral are called central. But it is very important to understand because we have got one lateral sound, that is L. Whenever you are going to produce, for example, I presented before you a word leaf containing three sounds, but at the same time having four letters. L, E, F. But I am concentrating on the sound L. L. What happens? The tip of the tongue is touching the alveolar ridge and allowing both the sides of the tongue to, allowing the airflow to pass through the lips. Okay? When I say point to remember, definitely you have to connect this slide with the previous one, because I use one word that is central. You must remember, that's the point to remember always. L is the only lateral in English. This is what I said. There is only one lateral sound, that is L. The other sounds of English, like most of the sounds of the world's languages, are central. That's very important to understand. I want you to remember this point always, okay? More specifically, L is a lateral approximant. The opening left at the side of the tongue is wide enough that the air flowing through does not become turbulent. When we produce L sound, remember, there is no turbulent airstream. So that's why I wanted you to remember this point, and that's why it is the annexed slide with the previous one. Okay? Well, dear students, we try to understand some theoretical points, but now we have got some graphics before us. We have to try to understand the consonant sounds by applying a different dimension. That's very important to understand. And first of all, I'm talking all these consonants under the places of articulation. That's very important to understand, or it is sometimes called POA, places of articulation. The place of articulation of a consonant specifies where in the vocal tract the narrowing occurs. That's very important, you have to understand. From front to back, the POAs that English uses are. Now, first of all, the places of articulation, you must understand what is in fact the places of articulation, a place of articulation. Now, it says that place of articulation of a consonant specifies, it specifies where in the vocal tract the narrowing occurs. Where in the vocal tract the narrowing occurs. From front to back, the place of articulation that English uses are. Now, number one, we have to understand. There is a diagram which is elaborating what I am saying. In a bilabial consonant, the lower and upper lips approach or touch each other. Now, when I say this, please try to look at the diagram. Can you see that? What is the position of both the lips? I repeat, in a bilabial consonant, the lower and upper lips approach or touch each other. Now, just correlate it with the diagram you can see now. For example, English p, b, and m are bilabial stops. English p, b, and m are bilabial stops. So the diagram shows the state of the vocal tract during a typical p or b, p or b. You can see m, yes, exactly, it looks like the same, but with the velum low to let out through the nasal passage, because at the same time m is a nasal sound. Alright, so for as p and b are concerned, our lips are absolutely touching each other. They are not allowing the airflow. They are stopping it. But so far as m is concerned, why? Because that is a nasal sound, and we have to talk about the soft palate because it has blocked the oral cavity and it is allowing the airflow to go through the nasal cavity. But remember, they are bilabial consonants, all these three, p, b, m. P, b, I mean in a speed when you say p, b, m, at once you find that p, b, alright, lips are together. So as m is concerned, alright, okay, lips are together, but at the same time velum is directing the airflow to nasal cavity. Alright? Now look at the labiodental. Labiodental. In a labiodental consonant, the lower lip approaches or touches the upper teeth. Labiodental. You can see in the diagram the upper teeth. The upper teeth. The lower lip is approaching the upper teeth. For example, English f and v are bilabial fricatives. What are they? They are bilabial fricatives. What I am trying to make you understand is that in a labiodental consonant, the lower lip approaches or touches the upper teeth. You can see in the diagram. For example, the diagram shows the state of the vocal tract during a typical f or v. You produce f, upper teeth, lower lip. Lower lip are approaching the upper teeth. Can you see? You produce v, this happens again. F, v, f, v. And both these sounds are known as bilabial fricatives. Bilabial fricatives. But their name is labiodental. These are labiodental sounds because we are touching the upper teeth with the lower lip. And the lower lip is approaching the upper teeth. Okay? Our next type is dental. Dental. Before we start reading, I want you to have a look on the diagram. Look at the lip. Are they touching each other? Not at all. What about the upper teeth? And which part of the tongue is close to upper teeth? Yes, exactly, tongue. So let's read it now. In a dental consonant, the tip or blade of the tongue approaches or touches the upper teeth. Now just look at the diagram again. The tongue or the tip of the tongue is approaching what? The upper teeth. I repeat, in a dental consonant, the tip or blade of the tongue approaches or touches the upper teeth. English th and the are dental fricatives. English th or the are dental fricatives. There are actually a couple of different ways of forming these sounds. The tongue tip can approach the back of the upper teeth, but not press against them so hard that the airflow is completely blocked. So I don't want you to do this sort of activity. I want you to simply touch the tip of your tongue with the inside of your upper teeth. Instead of blocking, these are very gentle sounds. Say after me, th, th, the. So gently you can produce them, right? What are they known as? They are known as dental fricatives. Now what is in the next statement? The blade of the tongue can touch the bottom of the upper teeth with the tongue tip protruding between the teeth, still leaving enough space for a turbulent airstream to escape. Touching it slightly, the tip of the tongue is touching the mid part of our teeth inside, but gently, and still leaving enough space for a turbulent airstream to escape. Th, th. Interdental, right? Interdental. But I would like you to follow simply by touching the tip of your tongue with the inside of your upper teeth and produce th, the. Now you can, this diagram which I've already talked about, you can see typical interdental, right? Interdental. They are dental sounds, but also known as interdental, th, the, depending upon the speaker. How does a speaker produce such sounds, right? So you can see the tip of the tongue is touching the inside of front teeth, all right, upper teeth. The next is an alveolar. In an alveolar consonant, the tongue tip, or less often the tongue blade, approaches or touches the alveolar ridge. The ridge immediately behind the upper teeth. The ridge immediately behind the upper teeth. And what articulator? Yes, exactly, this is the tip of the tongue that is approaching what? The alveolar ridge, the first stage, the first part of the alveolar ridge, soon after the upper teeth, right? For example, the English stops t, d and n are formed by completely blocking the airflow at this place of articulation. This place of articulation. Yes, exactly. When we say t, d, the things are different. when we produce n sound, what happened? That becomes a nasal sound. The fricatives s and z are also at this place of articulation. S, z. As a case of lateral, when the tip of the tongue is touching the alveolar ridge and allowing, the tongue sides, both the sides, are allowing the airflow to pass through the lips. Now you can see this diagram. What is the state of the vocal tract when you produce t, a, d? T, a, d. The tongue is absolutely touching the alveolar ridge, the first part or the first place. Alright? After alveolar, we have got post-alveolar. In a post-alveolar consonant, the constriction is made immediately behind the alveolar ridge. The constriction can be made with either the tip or the blade of the tongue. The English fricatives sh and j, j. The English fricatives sh and j are made at this place of articulation, as are the corresponding affricates ch and j. Now you can look at this diagram. When we are producing ch and j, what is happening? The constriction is made immediately behind the alveolar ridge. Can you feel it? When you produce ch or j, ch and j, yes, constriction is there. Where? Immediately behind the alveolar ridge. The next one is retroflex. In a retroflex consonant, the tongue tip is curled backward in the mouth. English r is a retroflex approximant. The tongue tip is curled up toward the post-alveolar region, the area immediately behind the alveolar ridge. Now can you see this diagram? This shows typical English retroflex r, 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 r. The tongue tip is curled backward in the mouth, r. It is curled backward in the mouth, isn't it? You can feel it. For example, when you produce r sound, r, r. And then you can just look at this diagram and produce by saying r. Look at this diagram and then say r. Okay? The next one is platal. And we have got only one sound, that is y sound. Remember, in a platal consonant, the body of the tongue approaches or touches the hard palate. The body of the tongue either approaches or touches the hard palate. Of course, that is the alveolar ridge part. English y is a platal approximant. The tongue body approaches the hard palate, but closely enough to create turbulence in the air stream. Y, yes, yesterday, you, your, ya, yummy. Our next type of consonants are velar. Remember, in a velar consonant, the body of the tongue approaches or touches the soft palate or velum. For example, English k, g and ing are stops made at this place of articulation. If you try to look at this diagram that shows typical k and g, though where exactly in the velum the tongue body hits will vary a lot depending on the surrounding vowels. As I told you during the previous session, sometimes the neighboring sounds, they do have their own effects on certain sounds. Now these are k, g, ing. These are the velar consonant, but at the same time, remember, ing is a nasal sound. Alright? What happens when we produce velar? The body of the tongue approaches or touches the soft palate or the velum. K, G, ing. Well, my dear students, the last among them is the glottal. As I told you time and again that h is the only glottal sound, and it is classified as a glottal fricative. Remember, the glottis is the opening between the vocal folds. In an h, this opening is narrow enough to create some turbulence in the airstream flowing past the vocal folds. So there is no turbulence. That's why you can see that the vocal folds are open when we produce glottal sound. And there is only one sound that is called glottal, that is h. H. Well, honorable students, what we have talked and we try to understand through the diagrams and of course through the statements, now this is the time to focus on the summary of the each and every consonant sound. That's why you can have a 4-column table in front of you, and we have to understand each and every consonant, what kind of they are, what is their kind, because you have had the elaboration of each and every consonant sound of English. Of course, I tried my level best to present before you certain diagrams so you can understand the place of articulation, right? What is the position of the main articulator? Of course, that is the active articulated tongue, and whether it's approaching towards the teeth, upper side, inside of the teeth, alveolar ridge, and what part. At the same time, we talked about the role of velum, of course, the soft palate. Now we have to summarize each and every consonant sound, because after this, I think we should try to understand the entire tables with what we have discussed so far. We should try to understand in the next session whatever the diagrams we have seen so far, so that we may be able to understand before jumping into phonology or phonology of English. We have to understand whatever we have seen, whatever we have done through graphics, through diagrams, through tables. But that's why I'm saying this session number 14 is very important, because I'm presenting before you the summary of each and every consonant, whatever we have done so far, from session number 1 to session number 13, and of course this particular session, session number 14. I want you to concentrate. One by one I shall pronounce the sound, and of course I shall tell you the category. Okay, the first one is p. It's voiceless bilabial plosive sound. P. Voiceless bilabial plosive sound. B. It's voiced bilabial plosive sound. B. It's voiced bilabial plosive sound. T. It's voiceless alveolar plosive sound. T. It's voiceless alveolar plosive sound. D. It's voiced alveolar plosive sound. D. Is voiced alveolar plosive sound. K. It's voiceless velar plosive sound. K. It's voiceless velar plosive sound. G. It's voiced velar plosive sound. G. It's voiced velar plosive sound. Ch. It's voiceless post alveolar affricate sound. Ch. It's voiceless post alveolar affricate sound. J. It's voiced post-alveolar affricate sound. J, it's voiced post-alveolar affricate sound. M, it's voiced bilabial nasal sound. M, it's voiced bilabial nasal sound. N, it's voiced alveolar nasal sound. N, it's voiced alveolar nasal sound. Ing, it's voiced velar nasal sound. Ing, it's voiced velar nasal sound. F, it's voiceless labiodental fricative sound. F, it's voiceless labiodental fricative sound. F, it's voiced labiodental fricative sound. V, it's voiced labiodental fricative sound. F, it's voiceless dental fricative sound. F, it's voiceless dental fricative sound. The, it's voiced dental fricative sound. The, it's voiced dental fricative sound. S, it's voiceless alveolar fricative sound. S, it's voiceless alveolar fricative sound. Z, it's voiced alveolar fricative sound. Z, it's voiced alveolar fricative sound. Sh, it's voiceless post-alveolar fricative sound. Sh, it's voiceless post-alveolar fricative sound. J, it's voiced post-alveolar fricative sound. J, it's voiced post-alveolar fricative sound. R, it's voiced retroflex approximant. R, it's voiced retroflex approximant. Y, it's voiced flatal approximant sound. Y, it's voiced platal approximant sound. W, it's voiced labio plus velar approximant sound. W, it's voiced labial plus velar approximant sound. L, it's voiced alveolar lateral approximant sound. L, it's voiced alveolar lateral approximant sound. H, voiceless glottal fricative sound. H, voiceless glottal fricative sound. So this is what the entire of the consonants in front of us. Of course, you have to concentrate the previous slide and this one. They are very important for understanding sake and for the point of view of your examination. They are very important sounds. I want you to refer to these slides again and again, again and again, again and again. And of course, the next slide is also very important, because with this we shall try to complete the first part of phonetics, right? I mean phonetics and phonology, the course phonetics and phonology. We shall inshallah complete After this session, of course, next session will be the last session so far as the first part of the course Phonetics and Phonology is concerned. And I told you during the first session that we shall be having the two parts. First is the phonetics, of course, and phonology generally, but then we shall be talking about the suprasegmental phonology. Do you remember? So we have tried to understand, of course, phonetics and at the same time phonology, but definitely when we'll be picking up the suprasegmental part of our course, we shall try to understand, of course, phonetics and phonology again. Is that clear? Now this is the complete chart for English consonants. On the top you can see some other headings. The left side you can see some other headings. So it is very important to understand this chart, as I told you, that when I was talking about the summary of the entire of the consonants, of course English consonants, I try to tell you what is the nature, right? So far as the manner of articulation is concerned, so far as the place of articulation is concerned, and so far as the voicing is concerned. So all these three categories have been mentioned in the two previous slides. On the left side you can see the sound itself is there, right? And then in accordance with the three dimensions, the three aspects, I hope you remember. May I recall, before talking about this chart, do you remember that when first we try to understand or we try to classify the English consonants, we try to understand that we want to, and we shall, and this is what we've done in fact, that we will try to understand the classification of English consonants on three bases. And the first base was voicing, second was the place of articulation, and the third was manner of articulation. I hope you remember that. And we tried our best to understand what is voicing by having certain examples. Definitely both of us, you and me, we try to get ourselves engaged in different kind of activities. At the same time we try to understand by pronouncing certain sounds, and at the same time we try to use those sounds in some words, and we try to understand, of course, there is a mismatch so far as the spelling of English language and the sounds of English language are concerned, right? And at the same time I still remember that I made a request that when you are going to talk about English sounds, you have to think in terms of phonemes, and I try to tell you what are phonemes. In fact, we try to understand the basic definition of phoneme, and then we started applying, all right, this is the way out to understand English phonology. And of course I want to talk about the three important branches of phonetics, which I still remember during session number 1 I had a talk with you, and of course session 2, 3 and some other parts of certain sessions I reserved for them. We try to understand first of all what is acoustic phonetics and articulatory phonetics and auditory, and that time came when we tried to say that, all right, the most important part is the articulatory phonetics, because the articulation is the most important thing. And I still remember the first photograph I presented before you, in which I presented before you a speaker, lips, and of course the hearers or the listeners ear. And I told you at that time, my dear students, it is not just such simple thing to understand that one is speaking, the other one is listening or hearing. I still remember that I used the word that there is much more behind them. When one speaks and one hears or listens, there is a complete story which we do not understand. I mean, at that time I said. And after having attended 14 sessions continuously without a break, first of all I would like to appreciate that you remain calm and quiet. At the same time you were a little talkative when I asked you to be talkative. And at the same time I would like to extend my thanks to all my students, because all of you got yourself engaged in certain activities. Without doing certain activity, it is not possible to understand phonetics and phonology. And yes, in the coming days, inshallah, I don't want to talk about the coming days what we'll be doing, but at least I can tell you that you will be engaged, and surely you will be engaged in different kind of activities, right? So the story started by producing a sound phonetics. At that time I still remember that I tried to tell you the correct pronunciation, because I said if you call this word as phonetics, so entire meaning are changed. So that's why I requested you to call or to pronounce this word as phonetics. And at the same time I still remember I picked up another word, and that was phonology. And I still remember that I mean I guessed some of the people, I'm not talking about you, but some of the people, generally speaking, if you ask someone, could you please pronounce this word, and most of the people would answer like that, phonology. And again I had a discussion with you people, now this is not the proper way to pronounce this word. In fact, these two words provided us with some sort of foundation so that we could talk about phonetics and afterwards phonology. And then of course we try to understand the articulative phonetics, and then acoustic phonetics and auditory phonetics, and of course we attached all these branches with the functional aspect, and that is the functional phonetics. Now when I'm winding up the first part of this course, it's very important to present before you what we have done. We have had analysis, we have had discussion, we have had certain activities, we have had certain examples to try to understand, and at the same time many diagrams I presented before you. I know that sometimes what happened, there is some element of tiredness, you know, some people get tired, of course, naturally, that when you are engaged in understanding this kind of technical course, naturally, because in the world of literature there are certain things we can talk, we can narrate, we can give examples, similes are there, metaphors are there, some other figures of speech are very much included in poetry, drama, and at the same time novel. You know, we have got characters, we have got definitely romanticism, whatnot is there. But to understand the technical type of courses such as phonetics and phonology, definitely one needs a different approach to understand this course. And now whatever we have done regarding the consonant sounds of English, the chart is in front of you. On the top, bilabial, labiodental, dental, alveolar, postalveolar, retroflex, platter, velar, and glottal. On the left side, you can see in bold, plosive, nasal, fricative, approximant, lateral approximant, and affricate. Now, first of all, bilabial. They are plosive, they are alveolar, and they are velar. Plosive, in the category of bilabial we have got p, b. In the category of alveolar we have got t, d. In the category of velar we have got k and g. Nasal, in the category of bilabial we have m. In the category of alveolar we have n, and in the category of velar we have got ing. Then we have got fricative. There is no bilabial. In the category of labiodental we have got f and v. In the category of dental we have got th and the. In the category of alveolar we have got s and z. In the category of post-alveolar we have sh and j. There is no retroflex, no platal, no velar. And in the category of glottal we have h. In the case of approximant, in the category of bilabial, we have w. In the category of retroflex, we have r. In the category of platal, we have y. And sometimes velar is w sound is also called valor, because this is bilabial valor. This is what I told you. In the category, then we have got lateral approximant, and we have only one lateral approximant, that is in the category of alveolar, and that sound is l. Our final class is affricate class. We don't have bilabial affricate, we don't have labiodental affricate, we don't have dental affricate, we don't have alveolar affricate, but we have post-alveolar affricate, and they are ch and j. And there is no retroflex in affricate, there is no platal, there is no velar, and there is no glottal so far as affricate are concerned. Now this is what the entire chart, and this is what we have been talking about throughout 13 to 14 sessions. Time and again, with different dimensions or different angles, we try to understand voicing, place of articulation, manner of articulation, to understand this world, the world which is in front of you. In fact, this is what we have been talking about throughout 13 sessions. And of course, the 14th session was based on that, both the theoretical aspects and the practical aspects. Theoretical, I elaborated. Practical, I presented before you certain diagrams so that you may understand what is in writing. At the same time, I tried my level best to present before you minimum matter on each and every slide. With the exception of some slides, there is no material available. I tried my level best to present before you maximum 2 statements. Why? Because what happens when we have got much matter on the slide, distraction occurs. I didn't want to distract you. That's why I tried my level best to elaborate whatever the statement you people were reading or listening to me. And afterwards, I tried to present before you certain examples. Is it clear? So this is what we have done so far as the description of English consonants is concerned. I hope that whenever required, you will refer to this kind of table, or the tables which I showed you time and again during all the sessions. And whenever I ask you, for example, maybe so far as your examination is concerned, the diagrams, whatever I ask you, definitely under some heading, so you have to recall to the diagrams, the tables which I presented before you during all these 14 sessions. All right. Well, before we leave this session and we close this session, I think it's very important to talk about self-assessment component, which is based on each and every session, as I promised when I was having first session with you people, that please always mark the live slide of each and every session which I shall be having with you. I still remember when I had the first session with you, and that is the most important and significant part, that is the self-assessment part. Remember, let me give you guarantee, whatever is in the component of self-assessment, if you people keep on doing these things, I'm sure by the end of the semester you shall be a different graduate, inshallah. This is what my belief is, because we try to understand each and everything by having different examples and by applying different dimensions and angles. So this is the last effort at the end of each session, rather another effort where certain other efforts are very much we try during the entire session. This is the last effort, in fact, from my side and of course from your side, to assess ourselves. Now today what you need to do is that you have to elaborate all the consonant sounds of English. all the consonant sounds of English, and at the same time please never forget that you have to draw certain diagrams where necessary, where you feel, all right, I need to elaborate, I need to explain this consonant sound, for which I need some sort of drawing. Maybe when I talk about the pulmonic airstream, do you remember? Yes, aggressive, not aggressive, aggressive and ingressive. All right, I can ask you and you can just tell me. So this time what you need to do is that elaborate all consonant sounds of English by drawing diagrams where necessary. So I read again, elaborate all consonant sounds of English by drawing diagrams where necessary. So this is what the task is. Please do and complete your task, and after completing it, read it again and go for some sort of improvement, and then afterwards put it in the folder. So thank you very much for this session. From my side, goodbye and good luck. Stay blessed.